Hi everybody, this is Nickey from Inspiration Hub, and today we are doing an author interview with Dr. Faizul Mansoor, the author of A Community Doctor in Miri. So let's check it out, and I'll see you there. So today we are very happy to have Dr. Faizul Mansoor on board with us, and we would like to find out more about him and also his book. So let's roll the questions. Uh, hi, Dr. Faizul. So,
Yeah.
how are you doing?
I think I'm okay. I have to keep fit, otherwise I'll be bored at home.
All right, all right. Especially during this MCO, right? Like every one
Yeah.
of us need to stay at home. Yeah. So you were the district health officer in Sarawak for quite many years. Would love to know how did everything actually came about for you. Like maybe you can share with us a story on that, like how everything started for you.
Okay. I did my housemanship in Kuala Lumpur in 1982. And then after completing my housemanship that time was only 1 year.
Mm.
And I came to Miri in 1983, August. So I was a medical doctor working in a hospital until 1989. That means for a good 6 years, I was a medical doctor. And here in Sarawak, there were only 6 of us running the hospital. And we were on call every 4th, 5th day. And we look after the whole ward. And we are actually responsible for the patients. We have consultants or specialists we refer to if we because some of the patients are beyond our abilities to treat, and we need their endorsement or their guidance as well. And then come 1989, I decided to pursue my studies in public health in University Malaya Kuala Lumpur. And upon returning in 1990, late 1990, I started my journey as a public health officer, no longer in hospitals. And now instead of patients being my in hospital patients, people are my patients, but in the community, the people around us are our patients. The community are our patients. Um, so public health is essentially about if anything goes wrong with the community, you must find the treatment for it, manage whatever is happening so that they will heal just like patients in hospital do. So basically it's like preventing diseases in a community, or if a disease has occurred in a community, then we must try to do something so that the time of the disease or exposed to the community is shortened, you
Mm.
know. So for example, if you have cholera, when you have a cholera, the patient will have to go to hospital immediately and you have to treat him for 3-4 days. But that is the patient's that is on an individual patient. But when a community is attacked by cholera, then we want to minimize the hospitalization of many people into the hospital.
Mm.
So what do? We have to do public health measures to make sure that we isolate the community, treat them, and take swabs from them. And if we can shorten down the transmission to 1 week only, then it's a victory for us. So that is roughly what public health is all about. It is preventing the community from getting sick. But if the community is sick, then we want to let them count of it as patients come out of the hospital treated. So that is what public health is all about.
All right.
So from 1990 until 2014, that is about 24 years, in public health, plus another 6 in hospital. So my life actually has been dedicated to the individual patients as well as community for the last 30 years. Yeah.
Wow. Okay. Such dedication, right? Because you really lay down your life to really just serve the, serve in the medical industry for the community, right? Yeah.
Right.
So what I know like this book is like you for you when you jot down and you like chronicle all the events that have taken place during your service as the public health doctor in Miri, and even probably like some events that happened before that. So we'd like to know what is your book mainly about, and or maybe what are the main stories you would like to highlight from inside the book.
There are many things to write, and sometimes I don't know where to start. So when an uncle asked me, say, you must include yourself when you were young, so that it can make the story more complete. So with his advice, I started to explore my younger days, and it fits really. If you read chapter 1, it was about growing up in rural districts, and then things were very slow. And when I came to Miri, things were also very slow. And then the roads that time were underdeveloped. We even followed the Sultan in his rounds to the villages upriver. No? So, and we saw communities coming up in the Felda schemes, for example. And with that experience, of course, I entered medical school later. And then when I start to write the book, there was some connection between the childhood experience into the present, what is written in the book. That means the rural development in the rural area in Pahang, for example, in Pahang, and then it could be extrapolated to Sarawak, and I guess then I think of arranging the book in sequence so that as you progress into the various pages or various chapters later on, it will come to an end where I guess that's where my contribution stopped. Okay.
So what actually inspired you to write this book? Like what motivates you or what triggers you during the beginning to start writing down all these stories?
Actually, if you look at the chapter, can you just show the book? All right. See, there are two things, two items, the stethoscope and the camera. So I bought a new camera before I came to Miri, and I had the previous camera, but it was an old-fashioned one. So with that camera, I started to take photos and take, and have a lot of them. And until towards the end, I was still taking photos. So these photos were all inserted into a book-like album, and good thing that it was all in the box. So all I need to do is to take out an album and look at it. Very fortunate. Some photos have dates with them, but the rest I just have to figure out when it could have been. So with the photos on one side, and then I could trace back my beginnings in Hospital Miri, and later on into public health. Then they were connecting, there were connections, and that's why I thought that I think these are the requisites for writing a book. So then I start to write, and the next thing is to select which photos to go in. Out of, I think my album in this Photoshop is about close to 3,000. You know? So it's a task trying to select the album. Luckily, I got the album to look at. The negatives are still with me, but
Wow.
that's another thing lah. And
Okay.
because of the stethoscope, the camera, and then the photographs, and I could see myself moving, and I kept on telling myself, life is not that routine after all. It is exciting. Every new day is an exciting day with all these happenings, outbreaks, diseases. So it was exciting that I just stay on in Sarawak, and I think, why not? Let us just book this all in the book. So that's a story behind it lah.
Yeah, interesting, interesting. Actually, I read some of the chapters, and I think you were there when you were handling the cholera outbreak, right, during a certain years. And maybe you
Yeah.
can share a little bit, like, do you still remember very vividly, like, how everything started and how you went into, like, put a stop to all these things from spreading?
Miri, in the past, the urban areas are all supplied with treated water. But as you go towards the fringe, that's where everything will start. Especially the first few cases of cholera was in Baram. It is devoid of water supply. And not only that, even in Miri town, there was quarter areas. There are some form of water supply, but it was also very minimally provided. So cholera always appear in certain times of the year. For example, in November, December, and when cholera comes up or came up during that time, it only started with one case. That one case will alert us to be careful. Uh, it's a time to mobilize all our staff already. So one case actually, it will we cannot wait for confirmation. We will just take it on and quickly go to the community and try to see if there are more cases, because the result will come back after 48 hours. If you don't do anything within 48 hours, that one case will multiply into 10, 20, just like our COVID at the moment.
Yeah, exactly.
So this is very interesting. So one case, unfortunately, we have this cholera during the El Nino time, where everything was dry. Miri was really devoid of water. The riverbeds were running dry. So that one case end up into 1,000 people affected over a period of 4 to 5 months. Just one case. We managed to overcome, but the spread was so quick that it's difficult to think ahead of how to stop this epidemic. We call it epidemic. So eventually, when somehow we overcome it after 6 months, I think everybody was exhausted. Maybe the cholera was also, the cholera germs was also exhausted. So it's just settled. But an interesting one was, of all places, it occurred in the jungle. When it occurred in the jungle, we have 10 days to make sure that it will not spread anymore. So when it occurred in the jungle, it started with, I think, if I'm not mistaken, a patient who was very ill and died. And the moment we got it, then we have to mobilize our staff to go up rural in Long Loyang. which was 3 hours by road to the river, and then from the river to Long Loyang, another 3 hours. And we have to mobilize all our staff to go there and to go to the community, do investigations and swabbings, and thank goodness, 10 days it stopped. So it was a success, but we didn't expect this to happen in a remote jungle area. So those are the experiences which I cherish and remember. And there are photographs there. The photographs I can explain, but to anyone who look at it, well, it's just another photo.
Wow,
Yeah.
okay. Yeah, there must be quite an experience to be able to like handle such an outbreak, right? And also I noticed in the book that you mentioned a lot of cultural things that you actually like about that you experience and you like in Miri. Like for example, like the boatmen of Baram, and you talk about their cultures and their heritage. Maybe you would like to share with us a little bit about what are the special things that you find in Miri that in terms of their culture and ethnicity and things like that.
You know, when I started working, I was always looking at the map, a huge map, which is there in the book. And I begin to find a pattern where the Ibans are in the lowland area, and then the Kayan are in the middle, and the Kenyah are further up in the towards Kalimantan. Then you have the Kalabits in the highlands, and then the Malays and Melanaus in the coastal areas. So we saw that kind of pattern, and the hardship was definitely there because each time we go, um, to any rural place, we have to mentally prepare ourselves. There's no water supply, there's no electricity, and but everybody seemed to be contented, seemed to be okay. And what I found about all these people, they are very patient people. Maybe it's because of we are living up there in the jungles. And really, I think if we are nice to them, they will be nice to us, certainly. But if we start off aggressively with them, I'm sure we won't get that cooperation. So it is cultural. It is a must that whenever we visit any villages in the rural areas, as for me and my troop, we will visit the Ketua Kampung first, just to tell him what we are doing in the community and so on and so forth. If there is any meeting, then it's through this Ketua Kampung that we will get help from. So this is, I mean, you have to humble yourself, but by us humbling ourselves and not asking them to come to the clinic when we are there, I think we create a kind of friendliness with them. So then the other part is we say we want to meet your community to talk about this, that, and that, some program. I say, okay, we will arrange it. But of course, beforehand, our staff already told the Ketua Kampung that there's going to be a program. So by night, everybody will come in, So we, the urban people, will say, pukul 8 mesti start, So 8 o'clock it is lah. So by 8 o'clock, everybody was just coming in. So everybody took their own time to come in. So finally, when I think the community also knows that the Pengulu knows that the Ketua Kampung knows that there's enough people to start off the meeting already. So we start off the meeting. So the meeting is in every kampung which I went, be it Iban, Kenyah, Kayan, or Kelabit, or Saban, speeches will start first. The speeches are start off with the Ketua Kampung to say a few words, and then his people, maybe his assistant also will say a few words. And after that, my turn. So the boss will have to give his speech and say why we were there and all that, why we are there, what is our purpose. And it goes on and on and on and on until 1 to 1.5 hours later, it is followed by entertainment, you know. So the meeting, after the meeting, there is sort of an entertainment. And then you can hear the sapi sapi is in the Orang Ulu areas, or the gongs in the Iban areas. And these people will start, the chief themselves will start doing the ngajat, you know. And while they perform very proudly, and the Ketua Kampung also must know to ngajat. After that, then he'll pass the baton to me. Now your turn, you know. So to refuse we should not refuse. So I just play with it and then dance with them, and that will continue. You may not believe it, until the next morning, you know. So imagine you are on the floor until 5-6 a.m. in the morning, and after that everybody goes back, you know. So but in that manner, that's how we get accepted into the community. And mind you, Nickey, they tend to recognize me, you know. When in Miri itself, they are always there somewhere, and they tend to recognize me. And sometimes I don't know who this person really is, no? But it's okay. I began to accept this kind of gestures. All right.
All right, all right. Famous, like just people know you from your service towards them. So popular in your own way.
Something like that.
Okay. Yeah. So thanks. Very, very good story. Very well shared story. And coming back to your book, when you write this book, who are your intended target readers, and what message from your book that you want to see reach out to them, and also probably being preserved for future generations?
I think when I acknowledge, and there were many names that were written down, these are to acknowledge the persons whom I've talked to, because although I have my side of the story, but I still like to interview them to know how they think about it. And when their explanation fits mine, I'm more confident in writing it down. So there are many names there, and people who are very experienced in their work, in whatever they do, and I get a lot of information from them. True that I have my own information, but gathering information, confirming, try to confirm events. So this getting of information connects me back to my staff. But there's a chapter about all the clinics in Baram, you know, all the clinics in Baram and Marudi. These are to connect back to all the medical assistants and community nurses, we call them Jura Masyarakat, that they are being acknowledged with the clinic, the photos, clinic photos, and sometimes I could picture myself with them. And that's sort of the connection which I want with the services which they rendered. So that is one part. And then for others who wants to know what Miri was in 1983, then there's a reference. At least they can refer to the book, you know. But the other thing, there's a chapter which I mentioned, the boatmen. I'm not sure whether they are still around, because you must be daring and need some skills to maneuver through the rapids, and that chapter was dedicated for them. But whether they will read or not, I'm not very sure. But I hope others will see that this is a profession which was dominating in the past, because nowadays all the roads are connected, all the villages are connected by logging roads. But in the past, the boat was the main communicating transport factor. So so I hope that people who look at the book will have time to read slowly so that they know what the book is all about. I also mentioned a few names inside there so that the people will buy the book. And then there are services which I wrote about, the flying doctor service. It is a service which was considered very essential those days, because communication has always been a problem. Even until today, not many villages can be connected even by the handphone, by the phone. But nowadays I guess it's a bit better compared to those times. So at least people can compare what was happening those times and what is happening nowadays. I hope all those who have lived in Marudi and Miri, Baram, especially the teachers as well, have a glimpse of the book, because they are being mentioned here and there, but not all over. So that's it lah.
Yeah,
Okay.
okay. That's a good one. And just lastly, if anybody is interested to like follow, let's say like follow your updates or your works, is there any way they can follow you on social media? And also, is there any other future projects coming from your side as well?
Hmm. Actually, I opened a Facebook, if you jot down a PKB space bar Miri, that will show all the things uh, about the lifestyle in Baram. How difficult was it to get there, and the villages and the people, trying to describe. So that's about it now. Unless people ask you how to connect to me, then you have to just give my email address. Yeah.
Okay, sure. Any like, do you have any plans for a second book or more stories coming from your side in another version?
Um, I don't know. Maybe my time is running out, but I'm trying to keep myself occupied. I'm trying to have a community doctor in Miri, another version with most of the things inside there, but maybe with some editing going on and some new chapters, and maybe a little about what I'm doing after retirement. So that means it will be from 1983 up to maybe up to today, up to 2020. So I can describe what I'm doing and my views towards what is happening at the moment. So that is one. Another one is I want to write about the midwife story in Sarawak, and not sure, but I think the materials are all there. It's just like sitting down and really focusing on it. Because I remember writing the first book, it's like 4 to 6 hours every day, without fail, just to get everything in. And there's round one, there's round two. After the first draft, there's a second draft. It takes about 2-3 years before before the birth of the book. So I plan to come with another one, but materials are all there. But now is to sit down and focus myself to it. So I hope it will come up by the middle of next year. Yeah, it's a midwife story. and dedicated essentially to all those doing midwifery,
Okay.
to
So
the
looking.
nurses, midwives, and doctors too. Yeah.
Okay, definitely looking forward to it. And yeah, I think writing a book is also like giving birth. So so much blood, sweat, and tears to put into the produce the book. Like you were saying, take a few years to write. So yeah, yeah, it's an interesting journey. Thanks for sharing today, Dr. Faizul. And we hope to, who knows, maybe we can do another one more show on another day where we can go deeper into other stories and things like that. All right, everybody, thank you very much for listening to today's interview session. So for some of you who are interested to get Dr. Faizul's book, we will provide a link on either YouTube or Facebook, depending on where you're watching from. So thank you very much for Dr. Faizul sharing. It's been so informative, such a pleasurable stories to hear. And yeah, so see you all around. Bye, Dr. Faizul.
Okay, bye.
Bye-bye. Hi, thank you for staying with us to watch the entire show. And if anybody of you are interested to get Dr. Faizul's A Community Doctor in Miri book, you can get it from Inspiration Hub link, which I will share in the either the YouTube or the Facebook page that's going to be shared. So yeah, I'll see you again and stay tuned.